They were suffering from psychosis or they were psychopaths. And I remember one moment where one of them looked at me and he said, "Are we alone in this building?" And it was nighttime, Civic Center, San Francisco, a pretty dangerous area. And I felt this chill go through my entire body. And I felt like, wow, he is intending to harm me. And so I lied and said we were not alone. And I knew in that moment he could tell I was lying.
Welcome to OTR, Over the Rainbow, Achieving Mental Health for Real. This podcast offers hope to many people who needlessly suffer from mental health issues. Your host, Bob Adelman, brings you information on how you can recover from any mental health issue and achieve a happier life. Each episode interviews experts like doctors, counselors, and life artists who give helpful tips on living a happier life. But most importantly, Bob interviews ordinary people who have suffered with a mental health issue, some on the brink of or attempted to take their own lives. Each one has recovered to lead a much happier life. Most of the guests have books or websites with more info that you can use for recovery. You can do it too. Bob's notes on today's show follows.
In this episode, I talk with Dr. Leslie Dobson. She is a forensic and clinical psychologist who has worked in very dangerous environments with dangerous people. Dr. Dobson has spent over 20 years in the assessment and treatment of mental health disorders in individual and group therapy, and criminal and civil law. She now has a private practice, using her education and training from working in a prison, a state mental hospital, and high-risk sex offenders just released from prison as a psychologist. She works today mostly with first responders and also testifies in civil litigations.
Now, here's Bob with today's show.
Hello, Dr. Dobson. How are you today?
Hi, I'm good. Thank you. How are you?
Great to have you on the show. Welcome. Could you tell a listener a little bit about yourself?
Sure. I am 40 years old. I live in California. I am a forensic and clinical psychologist. I've been working with people and hearing their stories for about 20 years. I spent a lot of my education and training and work in criminal psychology and working with violent offenders who suffered from severe mental health disorders. And I moved through working with veterans, and now I'm in private practice, largely working with first responders like firemen and police officers. And I also testify in civil litigation. And I speak to the truth of people's claims if they are claiming they were injured or traumatized by something, or on the defense side if they're claiming they did not do it.
All right, that sounds really good. This is a mental health show, so I always start off with, how was your childhood? Because that has a lot to do with the rest of your life normally. So how would you rank your childhood?
I think I had good parts and I had bad parts, but as I get older, I definitely realize that there were pretty significant bad parts that I didn't know were happening at the time. So I reflect on both of those. I was born in Canada. I moved homes many, many times, even before the fourth grade. And I definitely think when I moved to Southern California around the age of 12 or 13, I really started to struggle with the perfection and the pressure of this pretty superficial area. So I definitely felt like an outsider, and there were times where I didn't feel support from my family, and I felt very isolated, and that became depressive thoughts, kind of a dark side where I was more isolated from people and longing for friendships and we moved schools a lot. We moved homes and neighborhoods a lot. I didn't have a lot of friends. And until I started really engaging in my education in college was when I really understood what friendships were.
What college did you go to?
I started at Colorado State, and it was fabulous. I loved it there. But then I actually studied abroad to England to finish my bachelor's degree in Northern England in Leicester. The Americans call it Leicester, and then the English get very mad at us.
Okay. That sounds good.
I continued on to a master's degree at the University of London, and then I eventually returned back to California at Loma Linda University for a master's and a doctorate in psychology.
Terrific. So out of college, how did you start? Did you start a private practice, or how did your career take off?
I became very interested in severe mental health because it was really unimaginable to me. I had never been around severely ill people. I had never been in a prison. I had never been in a state hospital. And so I decided that my first experience on the clinical side was going to be at the Los Angeles County Jail. And I worked with a psychologist there to start a clinical experience for students.
Okay.
And I have to be honest, my driving force was that everyone told me I couldn't do it.
Right. So, but you got the job, you interviewed and got the job?
Yes, I got the clinical training. So it was unpaid. We don't get paid for a long time.
Okay. Were you living at home still? Or
I was living at home, and I was actually driving 4 hours each way to get to the jail for the experience.
Wow. That's dedication.
It was. I had a very old Ford Focus car. It was light blue, and I remember crying in it a lot.
Oh, boy. That's not good. Have you ever had any bouts with depression at all after that?
I felt, I had situational depression where I was very lonely and lost when I lived in England, or every time there was a large transition in life, I didn't really know how to handle it, and I would have depressive symptoms. But I think the worst part was I almost died around 2005. I had a perforation in my colon, and I had to have a colostomy.
Oh, no.
And it's since been reversed and fixed, but I'll never forget. Those were the first and the last times I thought about suicide. And I will always have such compassion and empathy for people who think about suicide, because I have never felt such a darkness in my life.
Yeah. Well, it's no fun. I went through severe depression, anxiety. It was definitely a low point in my life. I thought I was going to commit suicide. My sister kind of bailed me out. She had the same problem. It's inherited. So I had to hang in there for months, like six to 9 months it took before everything got a little bit better. But it's not a good thing. So after this prison job, what did you start doing that actually paid you money?
So internship pays you, but I want to say I was only paid $30,000 for the year. I went to St. Elizabeth's Hospital in Washington, D.C., and I got to work with a lot of individuals who tried to do things against the White House or the White House staff.
Do things? What things?
Tried to get into the White House, tried to kill staff members, tried to attack the Secret Service. And a lot of them suffered from very severe schizophrenia or delusions, had hallucinations. But it was incredible. It was incredible meeting these people and being able to help a lot of them see that life can be better, and we don't have to stay in the illness, that there are tools we can learn, that there's medicine we can take, and encouraging them through that year was really meaningful.
Wow. I mean, it's difficult to work with people, especially if they're psychotic or schizophrenic. I never got to that point. where I was delusional or anything, but I feel for those people. It's a hard disease to get under control. So you were in Washington for a year or so, and you moved on to what next?
That was just a year, and then you have to reapply. And I didn't want to stay there. I wanted to come back to the West because the weather was so painful. So I actually moved to San Francisco, California, and I started working with high-risk sex offenders. I was working with individuals who had committed very extreme crimes regarding sex, and
As a psychologist?
As a psychologist in an outpatient setting. So there was no security, and they would come in, we would work together, and they would leave, and it was pretty scary.
You didn't have colleagues or you just had your own practice?
I had, I would say, 2 to 5 different colleagues would be present in the building with me. And we would once a week meet and talk about the cases and help educate each other. But we also talked a lot about our own, what we call countertransference, how these individuals made us feel.
Oh, okay. So how did they make you feel?
Well, I think a lot of the time I felt very scared. I remember one moment where, a lot of the clients were male and had just been released from prison. They had their ankle monitors on, and they'd come into groups where I was the leader. They'd plug in their ankle monitors to charge, and then they would start talking. And a lot of the times they were on drugs. They were suffering from psychosis, or they were psychopaths. And I remember one moment where one of them looked at me and he said, "Are we alone in this building?" And it was nighttime, Civic Center, San Francisco, a pretty dangerous area. And I felt this chill go through my entire body. And I felt like, wow, he is intending to harm me. And so I lied and said we were not alone. And I knew in that moment he could tell I was lying.
Got lucky.
Yes.
Did you carry any mace or a gun or anything like that?
I always have pepper spray, and I have other legal weapons I keep with me. But no, I've never had a gun. I definitely think more and more about carrying a gun in this environment. But being Canadian, it's quite, we were raised that guns were not really a part of our world.
Right. U.S. has a lot of guns.
Yes, and
I don't know about California, but in other states, they carry them around all the time.
Right. I work with police officers now who come in, and they'll come in uniform, and they'll have their guns on them. And it fascinates me that they're so comfortable with their weapons, and I'm so unaware.
Did you ever fire a gun?
Yes, I've gone to the shooting range a few times, and I was so anxious. It was so loud.
Yeah, I went for a guard job once, and I didn't realize how loud it would be. Oh, my God, my ears were ringing like I went to a big rock concert for a long time. They didn't give me, muffled earphones, so...
Oh, I
guess you didn't get them either.
I had the little headphones, but they didn't do anything. It was.
Oh, okay. Yeah, I didn't even have that. So
I think I was most surprised by how hard it was to reload the bullets.
Yeah. What kind of gun?
Oh, I don't even know. I think they called it the Dirty Harry gun. I don't know.
Oh, okay. Go ahead and make my day. All right. Yeah. That one. Yeah, that's good. So, how long did you stay at this job that was pretty dangerous?
I actually only stayed working with sex offenders for a year. And then I was hired with my husband, who was a psychologist too. We went to Atascadero State Hospital, which is Central California, and it's a maximum security facility where you have active inmates, or you have individuals who have served their terms in prison but are still too dangerous to leave. And so they're treated as patients in the facility.
Right.
And
Right. Are you still married?
I'm still married. We have that trauma bond.
That's good. So you wound up in this hospital, you said?
Yes, I walked the halls of that hospital for about 6 years.
Oh,
It
okay.
was 2,000 staff members and about 1,200 inmates and patients.
Did you ever have trouble with people in the hospital? Did they give you any problems?
Every day, multiple times a day. We wore alarms on our hips that it looks like a tic-tac box, and you would pop it open if someone was going to assault you. And then you would run.
Did you have a guard or anybody that could help you right away?
So, California is very underfunded. We had a lot of security officers that were around, but no one was ever stationed anywhere. And so a lot of the time it would be clinicians, nurses, social workers, line staff who would run to the emergencies. And the emergencies were 6, 10, 20 times a day, every day. And they were violent episodes.
Wow. So did you ever get hurt or anything?
I got thrown against a wall once. I had my chest grabbed once. But a lot of the time I was able to get away from actually being physically touched. So there were many attempts, but I was able to circumvent it. And my husband was thrown over a chair. He was definitely harmed more because he would try and help stop a violent episode from happening, when I tended to back away a bit because I have no skill in that area.
Yeah, I mean, I don't know what I would do, but I'd be scared to death, I'm sure.
I was scared to death, and I definitely still have symptoms of trauma from that job.
Like PTSD, yeah, sure.
Yeah, I don't think I would meet full criteria for PTSD, but I get nightmares. I'm very hypervigilant. I can read a room in a second. I know every exit. I don't mean to, but I profile everyone the minute I meet them. And it's what I learned to keep myself safe. Yeah,
you picked up some skills there. So you were there how long?
About 6 years.
When did you move into being a forensic psychologist, appearing in court and as an advocate?
So when I was in the state hospital, we were subpoenaed and we would testify. We interacted with the legal team as a representation of the state of California. When I left there, I moved into this whole new world of personal injury and civil litigation. So this wasn't criminal anymore. It was just you and me on the outside getting hurt and suing, and this whole new world. And so it's been about 4 years now where I've been in this other world. I still take criminal cases if I feel like I can really bring something to the table. For example, if I've worked with a rapist and I've worked with a victim of rape, I can really help teach counsel the dynamic that's going on in those instances. But mostly I deal with civil lawsuits, and that's about half my week. And the other half is working with really, really cool people in therapy.
So you have your own practice now?
I do.
Okay. So what do you like? You like one-on-one therapy best out of everything?
I have to say that's where I feel the most alive and the most connected. Is just talking with someone and helping them move through their stuck points and their struggles. But if you asked me what I like the most financially, that's definitely working for the court system.
I got you. Yeah, that makes sense. The people that you treat, is there a specialty that you have?
Largely trauma. Yeah. So we use a lot of different techniques to work through traumas, and it depends on what the trauma is and how severe it is. But my goal is to empower people to feel better, and we find any which way to do that and get there. And it may be the relationships in their lives, it may be their self-confidence, it may be working through past trauma. So anything and everything comes to me, and I will figure out a way to help you feel better.
Oh, good. Maybe I should try that. I mean, I'm on my way to feeling much. I mean, I really am 100 times better than I was, but I still have some anxiety demons that are around a lot. You know, they kind of hover over me. You worked with schizophrenics and psychopaths in your practice, or just when you were in the courts?
I see nonviolent individuals with psychosis and schizophrenia in my practice. If I decide that somebody is more of a psychopath, I won't keep seeing them because of the threat of danger.
Okay.
But you know, it all depends. If somebody wants to get better and it's a really genuine desire, I'm here for it. I will get on the train and we will work.
So over your career, what was your most dangerous situation that you were in? Was it when the person asked if you were alone, or were you ever in a really bad spot?
Oh, yes, many. When you asked me that, the first thing that came to my mind was when I was in the state hospital and I heard an alarm go off. And usually I look around to see where it is, and it was right in front of me. And one of my colleagues was being beaten to death by a patient. And
oh my God.
it was me. I had to respond. And as I didn't even know I was doing it, as I dove forward to try and help where I would have just been pummeled, other inmates pulled me and threw me against a wall, and they saved the staff member.
Oh, they did. Okay.
And they got beaten very badly by this one individual. But that stands out to me as probably the most traumatic moment because it was the first time I'd ever seen anything so horrible.
Wow. Yeah.
And I spent days and days ruminating, playing the images over.
I can imagine.
And I really had to use...
That's terrible.
It's terrible. I really had to use my skills. And man, it was hard. It was so hard to overcome that. I had to really be strong with what I'd learned about how we overcome trauma.
Right. Yeah. So you could just imagine the people that were in war, especially a war like Vietnam or worse. And, you know, these people wind up on the streets because they can't come back. You know, they have nightmares all the time. And I know there's a lot of work that's done with PTSD, but,
it's such a slippery slope because, you know, a lot of people turn to substance use to numb the pain of the trauma, and then that becomes the real problem, right? We can't even get to the trauma because the substance use is blinding us.
Well, I think anybody that has an addiction is trying to numb themselves from some kind of mental pain. That's why it's so important that we address mental pain, you know, when it first starts, when you're a child. Like when I was 11, my parents were from World War II era. So there was nothing, you know, they didn't do anything. And my sister-in-law finally said, this guy needs a psychiatrist. And I finally got some help, but it wasn't much. And then later on, it got much worse. And in my 30s, I just, you know, I just collapsed. It was a terrible thing. But the other thing that I wanted to ask you about is SMART goals. Mm-hmm. And why does this keep us motivated? What are SMART goals?
I love SMART goals. They're commonly used in big corporations, and it's a tool to get your team to be working more efficiently. But I like to use them in therapy. So, and I like to use them for myself. I like to set a goal for myself, or several goals, every week. So I'll do it on a Sunday, I'll do it on a Monday, and we define them as SMART. So they are specific, measurable, achievable, relevant, and time-bound. And I can break that down a little more if that's helpful.
Sure. Yeah.
Okay. So an example this week for me, I really wanted to exercise and I wanted to write a report that I've been dreading writing because it takes so much effort. So I specifically said to myself, I'm going to write the report to this point by Friday, and I'm going to exercise at least 3 times during the week. But I wanted to make that even more specific. So I said, I'm going to exercise on Monday, Wednesday, Friday at 9 a.m. until 10 a.m. And I'm going to work on the report during these specific hours. And I wrote it in my calendar, and then I found that I was bound to that. And so that's the specific part. The measurable part was I wanted to make sure that I could see that I was actually doing it. So I set a page limit for myself. With the report, I want to write at least 20 pages, and I want to write 5 pages in each segment that I'm working on. With the exercise, I wanted to make sure I had my workout clothes ready and I could grab them first thing in the morning, and I couldn't move away from that. So they were right there. I had a measurable goal if I chose to grab the clothes and put them on. And then they were achievable goals, right? I wasn't going to say I'm going to write 1 million pages this week. I'm not going to exercise 40 hours. I can't do that. They were relevant. They were both things I need for my health and for my job. And then they were time bound. So they didn't overwhelm me because they were amount of time that I could really work with. And I didn't want to procrastinate it, and it didn't feel like too much. So as I talk to you now on a Friday, I've achieved those goals and I feel really good about myself.
Great. Sets those dopamines
Yes.
off.
Yeah. So I feel like I can really reward myself tonight with watching some bad TV, and I won't feel guilty.
That's good. Do you watch CSI and Law and Order? I mean, how realistic are those shows? Because they seem kind of not realistic to me. But are they?
I would say they're 10% realistic.
Yeah, it's just like, everybody talks in turn. Nobody ever steps on each other, and they talk real fast. I can't even watch the show because with my ADHD, I can't keep up with what they're saying. They talk so fast.
And the reality is that our government is underfunded and things are very, very slow, and we don't have enough people to look into things. And so maybe one of those episodes would really be 4 years in our government.
Yeah, I believe that.
But there are some movies that I think have done a great job. Like the recent Joker, I think he did an excellent job portraying someone really struggling.
Right. Heath Ledger, yes. Unfortunately, he was struggling as well.
Yes.
So that was unfortunate, but yeah.
So they're hard to watch if they're not good, and then if they're good, they're hard to watch because they're so true.
They're so good. How about the one with, what was the one where he had that thing on his face with...
Was it Hannibal Lecter?
Yes. Was Hannibal Lecter realistic, or was that way over the top?
No, I found that to be very realistic with psychopaths that I've worked with.
Really?
Over the years, learning how deeply rooted they are in these systems, and we aren't even aware. As the clinician, I'm not aware. I think the police and the FBI and the CIA are very aware.
Do you think their problem is they don't have any compassion? Their brains just don't have compassion? Do you think that's the problem? Or it's something deeper than that has to do with their childhood or something?
I think it's a mixed bag. There's research that shows that the brain structures are different, and they literally need higher levels of stimulation to feel anything. But then that tells me they still feel, right? So they still have something you can work with. And I've seen it start in 2 ways. I've seen psychopathy start because of a childhood of abuse and trauma, and manipulating the world became the way that they survived. But I've also seen it start when someone's 5 years old and has this interest in killing animals and doing horrible things. So unpacking that is often helpful when you meet them. And it's also helpful to assess how dangerous they are and what they're trying to do and what they're capable of doing.
Yeah, it's terrible, but people are interested in that because what the crime show is number one, or what's it called, crime podcast. People like to watch that stuff. I don't know why. I don't particularly like it, but I guess it's very interesting to most people. I just wanted to talk to you about one other thing, that's setting boundaries in relationships. What advice would you give for that?
Yes, this is a big topic in the world right now. I really realized during COVID how isolation and the lack of socialization affected people differently. I realized through a lot of my clients that some people really enjoyed having the permission to stay away from everyone. And so I started writing this book a few years ago about what to do after COVID. And we are so isolated in COVID. Some people really enjoy that isolation, some don't. But now that COVID's ending, how do we go back into the world, giving ourselves permission to have healthy relationships and healthy boundaries? My fear was that so many of us would be slingshot back into the world, and we would be around toxic people. We would be engaging in relationships and social settings that would drain us. So the book, it should be out in a few months. I can't decide on the cover art, but it's...
Yeah, I was going to ask you about the book. What is the name of the book and how can you get it?
It's called The Friend Cleanse, and Richter Publishing, we're going to start doing some advertising and putting it out there, but it'll be on my website on drlesliedobson.com. And
also on Amazon as
well?
Amazon,
we're going to put it on all of the online platforms, and then we're going to do an audiobook, but that comes, we begin that at the beginning of 2024.
So when is it coming out, the book?
The goal is for New Year's, as a New Year's resolution.
Oh, okay.
So we can take charge of 2024 by really taking charge of our relationships and our energy.
Did you write the book yourself, or did you get help writing it?
I wrote it myself, and I have had a publisher help me, and then my husband, the psychologist, has helped me a lot too. And then because it's about relationships, I have asked everybody I know for input and moments in relationships that have stood out to them, types of friends they've had. So I've tried to really incorporate everyone's views on how they see the people around them and who they've experienced.
Wow. That sounds interesting. Before we end, I always give my guests a chance to say whatever they want to the audience. Do you have something you want to say?
I think what comes to mind is the world is a very difficult place right now, and we can all feel really, really shitty at times. But if we line up our support and trust in the mental health professionals around us, it doesn't have to feel as bad. And so I encourage people that even if they have a slight gut reaction or a slight instinct where they might want to seek help, to just do it, to just call, make the appointment, join a support group. Don't take on this world alone, because your life has meaning, and you can empower yourself to be happy, to make change, and then change this world.
Yeah, that's what we have on the show. People that have come back from, I'm living proof, coming back from, just almost deadly disease, because it brings you so close to wanting to kill yourself. It's very dangerous. But a lot of people come back and they have a much happier life. And so even if you're down and out right now, I think you have to ride it out. And then I think almost always you get better.
Yes.
You know, if you hit bottom, you almost have to get better. So if you just hang in there and have some resilience,
right,
things will pay off eventually, I think. Do you have a website link?
My website is drleslieDobson.com. Doctor is DR. And then I am active on TikTok and Instagram as Dr. Leslie Dobson. I've only been doing it for a few months. I don't have a lot of followers, but I'm going to start blasting off in those areas.
Well, that's okay.
I think that
I'll follow
I think it's helpful. I think people are finding my messages helpful. And if that's all I can do from a distance when I don't get to know everyone, then I'd love to.
Yeah, I thank you for doing that kind of work. You sound very sincere, but like you care about people, which is, not so popular these days. But it's great to hear people that, really want to help. And you've been a terrific guest. And again, I thank you very much. And hopefully we'll talk later down the road. And it was a pleasure talking to you. Thank you very much.
Of course. Thank you so much for having me on.